Okay, let's move on to the ears. So you're going to inspect and palpate the external ear first. The ears should be of equal size bilaterally with no swelling or thickening. Um, the skin should be intact with no lumps, bumps, lesions. Um, there should be no redness, no excessive warmth, no crust or scaling. Um, Nothing like that on the ear. The pinna and the tragus should feel firm. Movement should produce no pain. You should palpate the mastoid process. Um, there should be no swelling, no redness or discharge. A sticky yellow discharge accompanies otitis externa or may indicate otitis media if the drum has ruptured. Some cerumen is present, usually. The color varies based on ethnicity, and it varies also from being moist and waxy to dry and desiccated. Impacted cerumen, though, is a common cause of conductive hearing loss. You can look at the ear with the otoscope. Make sure that you choose a speculum that fits comfortably. You tilt the head slightly away from you toward the opposite shoulder. Pull the pinna up and back on an adult or older child. And it should be down on someone less than 3. You should hold the otoscope upside down along your fingers so that your hand can also be placed on the person's cheek to brace the otoscope in case they were to move. The external canal should not have any redness or swelling, any lesions, foreign bodies, or discharge. If there is a discharge present, you note the color and the odor. For a person with a hearing aid, note any irritation on the canal from poorly fitting ear molds. Okay. You're going to look at the tympanic membrane. It should be shiny and translucent and pearl gray. The cone of light reflex should be prominent at the inferior quadrant, with the cone of light reflex being seen at the 7 o'clock position in the left eardrum and the 5 o'clock position in the right eardrum. It's the reflection of the otoscope light. You should not be able to see any air or fluid bubbles behind the eardrum. The eardrum should be flat, slightly pulled in at the center, and flutters when the person performs the Valsalva maneuver or holds the nose and swallows. A bulging eardrum may be from increased pressure, or a retracted drum may be due to vacuum in the middle ear. You're looking at integrity of the membrane. It should be intact. A perforation shows as a dark oval area or a large opening in the drum. Some adults may have some scarring or dense white patches on the drums that were a sequela of repeated ear infections. You should perform the whisper test, one ear at a time. You place a finger on the tragus of the ear you're not testing. Shield your lips. Stand 1 to 2 feet from the person's ear and then whisper a set of 3 random numbers or 3 random words. Normally the person should be able to repeat the numbers or words back to you in the correct order that you set them. If a response is not correct, repeat it using a different combination of the 3 letters, numbers, or words, and then assess it on the opposite side as well. I'm not worrying about tuning fork tests. You have to remember that in infants and young children, that the top of the pinna has an imaginary line that should extend from the corner of the outer canthus of the eye. So the top of the ear should be in alignment with the outer canthus of the eye. Low set ears are found with trisomies 13, 18, or 21. Large prominent ears are misshapen, are often from syndromes with underlying ear structure abnormalities. Preauricular skin tags may occur alone or with other facial anomalies as well. Remember that in children less than 3 years old, you have to pull the pinna straight down to get a visualization of the ear canal. For the aging adult, you have to remember that the earlobes may be pendulous with linear wrinkling, that they have coarse, wiry hairs may be present at the opening of the ear canal. The drum may normally be whiter in color and more opaque. It may also look thickened. They may have high tone frequency hearing loss. And then if you look at page 89, you see some of the abnormalities of the ear canal or tympanic membrane. You see a retracted drum. You see excessive cerumen. You see acute otitis media. You see otitis media with effusion. And then on page 90, you have a perforation or otitis externa. So those are some of the abnormalities that you have with ears.